Alright, hi everyone, this is Trista with Burst Bliss. Today we had a very special guest. Her name is Laura, and she is a La Leche leader and a birth class instructor and an afterbirth doula. So she really knows her stuff and she has a lot to share. So I'm really excited to have her with us today. So Laura, my first question is, what is a good latch, and how can you tell if it's a good latch?
Well, one of the best ways to ensure a good latch is to encourage the baby to open really wide. The baby needs to get most of the areola in her mouth, and so I have a little breast
Awesome.
diagram, or whatever this is, a little breast doll here, and I think one of the most common mistakes is the puppet is a little ridiculous. I think one of the most common mistakes is baby needs to open really wide. Babies have little tiny mouths, and often when mom gives birth, her breasts grow, as does the areola. And so a lot of times baby will open and just get the nipple. And that can cause pain for mom, an improper latch for baby. The breast doesn't get drained properly, and then you can have supply issues and growth issues. So when baby opens really wide, the baby's going to get the entire areola, or at least most of the bottom portion of the areola in her mouth, and then come to rest comfortably at the top.
Awesome.
So that's one of the things that you can tell that baby has a good latch, is that the baby's opened really wide and gotten a majority of the bottom portion of the areola in her mouth. The lips should be flanged, so they should be, the bottom lip should come down like this, and the top lip should flange out as well, with the top lip resting comfortably on the breast. The nose should be clear. You should be able to, if you pull the bottom lip down, see the baby's tongue resting on the bottom lip, which you can kind of see the puppet showing you here. And you should also, when baby's sucking vigorously, sometimes you can see the jaw moving, the ears wiggling. Bless you. The ears wiggle. You can see the sucking occurring. Suck, suck. There might be a slight pause, and then the baby will swallow. Suck, suck, pause, swallow. When there's an improper latch or a poor latch, it's going to hurt. Mom might be uncomfortable or in some pain. The lips might tuck in. That's a common issue that babies sometimes have as well, as they sort of suck in or tuck in their bottom lip. And so you can pull down on the chin or help pull out the lip. You may not be able to see the tongue. If you see the cheeks dimpling, if you hear a clicking noise, if the baby's not swallowing, those are also signs that the baby has an improper latch.
Awesome. So are there any good positions that'll help with the latch, or are some positions better than others?
I think that positioning oftentimes is a preference issue. I know that oftentimes the best position often to hold baby is skin to skin, especially when if you're having difficulties, if you have a really sleepy baby, if baby's really fussy and you're having a hard time getting baby on the breast, you could always bring the baby in this position, skin to skin, and that sort of helps recenter the baby. It also turns on the baby's instinctive feeding behaviors. And so a lot of times when baby's skin to skin, you'll eventually start to see the baby's head kind of bob like this or peck around a little bit. They also may start to make some snorting noises. They start to snuffle. You might see them start to do like the lizard tongue or the snake tongue. They may even start drooling as well, or some saliva might appear. And then oftentimes the baby will pick a side and sort of scoot down and pick a side, and then you can just sort of make sure the baby obviously isn't going to fall, hold the baby, support the head, and they might just even latch on their own. I often encourage moms to make like a C with their hand or a U shape and support the back of the baby's shoulder girdle with their hand this way instead of holding the baby's head. Some babies aren't they don't enjoy their head being held. I mean, I know I wouldn't want someone to push my head into my plate of food, you know, and so to just scoot the hand down, support the shoulder girdle, then the baby feels really supported. And actually, when you put your hand behind your head or behind your baby's head, it causes an automatic tilting of the head, which allows baby to get more access to the breast. They need to tilt their head back, and then they can open wide. If you come at the breast like this, chin down, with your mouth open, you're not really going to get a good access to the breast. So this is just one position. It's laid back breastfeeding is what it's called, where you can just be at a 45-degree angle. Like I could even nurse in this chair, you know, if I had a baby. They just scoot down and I could support them like this. I could have my hand here. I could even be supporting my breast if I needed to. Some other positions that moms find comfortable would be the cross cradle. This is recommended for a newborn baby. The cross cradle is the opposite arm to the breast that you're using. And the back of baby is on my forearm. I'm supporting the shoulder girdle and the neck, like I mentioned. And now I can use my free arm if I need to support and hold the breast. This way baby can lean back and come at the breast and get most of the bottom of the areola, as I mentioned. Some moms like the football hold, especially if you've had a cesarean. This is really more comfortable as it does not put the baby across your abdomen, across your incision. And then eventually you can go to the cradle hold, which you may want to wait a couple weeks until the baby's a little stronger and you feel more comfortable, because this doesn't give much control for baby's head. You could latch the baby on with the cross cradle, get baby going nice and good, and then switch to the cradle, which some moms like to do. Awesome. I try not to get into too much with positioning because, you know, you can really start to make this very much harder than it actually, you know, than it really needs to be. As long as baby's head is towards your breast, baby doesn't have to turn head to nurse. You know, I wouldn't want to nurse like this because then baby has to turn head. You want to be, you know, tummy to tummy and baby being able to face your breast. And then after that, it just sort of, you know, what feels good, what feels comfortable. You may want to put a pillow underneath. You always want to remember to bring baby to the breast instead of breast to baby. Always try to sit up and bring
awesome.
Baby.
That was good information. Actually, what I got out of it was I've been actually holding her head because it just felt natural. But it makes sense because she was pushing back on me. I'm like, come on, baby, come on. So
right. And sometimes, you know, I'll hear, well, she acts like she wants to nurse, and then I put her to the breast, and she comes off. And I put her back, and she comes off. And sometimes it's, you know, it could be, it's not always the reason, but sometimes it could be just because, you know, baby's trying to get you off their head. So just put your hand down, and then often they're a little bit more comfortable.
Yeah, that makes sense. Because, like, when you push on their feet, they do the scrunch thing. So if you put your hand on their head, they're going to push back.
Yeah.
Kind of deal. It makes sense. So, thank you. Good
I'm going to go deal with her.
Okay.
She's annoying me. Hold on a second.
Does it sound good?
Mm-hmm. She sounds like a researcher. I'm totally picturing that you're talking to research.
She's a good talker. It'll totally surprise you what she looks like. Yeah.
I just left the back door open so she can come in.
Yeah, it's nice out. Awesome. Sounds really good. I'm glad you brought out the puppet. I always like the puppet.
It's that or start touching myself. So. I'd rather touch the puppet.
Who's this crazy lady touching herself? All right. So my next question is, when should a baby eat? You know, do I need to set it every 2 hours? Because, you know, they like to say they need to eat every 2 hours. So when does she really need to eat? And how long?
You want to put the baby to the breast 8 to 12 times in a 24-hour period. So that, you know, it averages out to be around every 2 to 3 hours. And every baby is a little bit different. Babies, because they get different amounts at each feeding, It could be a full feeding at one time you nurse. The next time maybe just for a couple minutes because she was thirsty or something like that. So you never really know how much the baby's getting. So you want to make sure that they're latching on at least 8 to, I said 12 earlier, but 8 to 10 is probably more manageable. 8 to 10 times in a 24-hour period. So that might mean for one baby that they're nursing every 90 minutes or so for a little while. And for another baby, they might really go every 2.5 to 3 hours, just like clockwork. Every 2 hours, the baby latches on. Whereas one other baby might have a 3 to 4 hour stretch and then do a little bit of cluster feeding, which is just nursing a lot over a small period of time. And then they crash out and take a long nap or something like that. So you want to really watch your baby and start looking for their cues that they're wanting to nurse. And so, you might see the rooting response, like the snuffling. They might open and close their mouth, put their tongue out. They might smack their lips together. They might, like I said, if you've got the baby on your chest, they might start to peck around. They might start to snuffle around. And as they're pecking around, they're also sometimes opening and closing their mouth. They might start to fuss. They might, furrow their brow. And then crying is the last sign of hunger. Crying is the last way that they're trying to tell you that they need to nurse. A lot of times moms, their baby starts to do anything fussy or they start to root around and they just put them right on the breast. And usually, most of the time, that's all it takes. You want to let your baby nurse as long as they want to nurse on any particular side. So, one of the benefits of breastfeeding is that it reduces the chances of obesity in adulthood. Wow. And one of the main reasons for that is because breastfeeding teaches babies how to regulate their own nutritional intake. A baby will nurse for as long as they want to. And then when she's done, she'll come off. She'll be full. She'll come off. You can burp her. And then maybe you want to offer the other side. And she may or may not take it at that particular feeding. So for one baby, it might be 10 minutes on each side. For another, it might be 20. I hate to put time limits on it just because it can be it varies so much from baby to baby and even feeding to feeding. So I just encourage moms to follow their baby's cues and, learn to trust that your baby's going to tell you what they need.
Right. Yeah, I think that's the main thing is trust your baby to know. I know that's big.
Yeah, and that's, that's not always easy to do right off the bat. It takes some confidence. It takes some getting to know your baby. Your baby's trying to tell you stuff. You're trying to figure it out. And sometimes it's a little practice.
Right.
In the first few weeks, it may be a little bit more, you may be watching the clock a little bit more just because, especially if you have a really sleepy baby, who you have to wake up a lot. A baby with jaundice sometimes can be really sleepy. You may have to wake yourself up in the middle of the night in order to wake your baby up to nurse, in those first few weeks as you're trying to establish milk supply as well as making sure that your baby is getting adequate nursing time and that your breasts are getting stimulated enough.
Awesome. So this is a personal question too, because sometimes I feed her and then she'd come off and like spit up like all the milk. It seems like all the milk she just ate. Is that a sign that she ate too much or she just got a little bubble and she just wanted to spit up?
No, it could be a bubble. Like I said, because breastfeeding teaches babies to regulate their own intake, it's very, it's not common that a baby could eat too much. They're gonna come off when they're full. Definitely, sometimes with the burp comes up a little breast milk, and spitting up is very normal. If a baby's upset when they spit up, cries, seems very agitated, then it's possible that we could explore reflux as an issue. But generally, when babies spit up, they really don't care. They're spitting up, they got it's coming down their face, it's all over there, and they're just like, whatever. And so, it can be kind of upsetting for us. It's like, whoa, especially if it sort of projectiles smiles or just gets over everything. But it often looks like more than it really is. I mean, if you take a teaspoon of water and pour it on your counter, you're just going to watch it spread out, and it looks like a lot. But, the reality is that it's probably not very much.
Okay, awesome. Good to know. Now, at night, if she's sleeping for a long time, do I need to wake her up and make her eat, or do I let her sleep some more until she wakes up and she's hungry?
Yeah, that, like I said, that is going to be a case-by-case basis, getting to know your baby and the situation of how was your birth, what happened during the birth, is the baby recovering from something, is the baby jaundiced, really sleepy, falling asleep at every feeding, and you're struggling to keep the baby awake to finish the feeding. In those kind of situations, yes, you're probably going to need to wake your baby up. Once your milk comes in, and around day 3, when your transitional milk is available to the baby, you can start to allow for 1 3 to 5 hour stretch of uninterrupted sleep in that 24-hour period. And so obviously we want that interrupted stretch to be at night. But a lot of times parents, just because they're tired and, before they know it, maybe their baby has had that long nap during the day. And so in that situation, you may need to wake your baby up until you, like I said, you start to feel comfortable and confident with latch, with supply, with your baby's growth, baby's gaining weight, appropriately, and all of that. And then it might be okay for your baby to sleep longer at night without having to wake your baby up. Sometimes parents realize, once they let their baby sleep without waking them up, their baby will wake up on their own shortly after they would have woken them up. You know what I mean? So if you're waking your baby up because it's been 3 hours at night and you go to wake your baby up, maybe the next night, if you think, well, I'm just going to let my baby sleep and see what happens, then it's pretty likely that your baby is going to wake up on their own at maybe 3 hours and 20 minutes or something like that. So it's kind of there's really no solid answer to that. Some parents like to wait until they get to that 2-week weight check at their pediatrician and then decide, okay, we're going to see what happens now, let baby sleep, because they need that reassurance that their baby's doing okay. And I honestly, I never really tell parents. I give them some suggestions, and it's really up to them to decide what's best for them and their baby. I can't advise them to, just let them sleep or what. That's not really my role. Is to just offer suggestions and information, and parents make their own best choice.
Of course, and it's a baby. Every baby's different too, so this
right.
isn't set.
Right, and some babies are different day to day.
Yeah, yeah, definitely.
You don't really. Some babies are very predictable. They're born with their circadian rhythms already established, and other babies are kind of very unpredictable, and it's really hard to nail down patterns because you think you have it figured out, and then they switch it up on you.
Of course. So now, is breast pumping necessary?
Breast pumping is not necessary for the average nursing mom. Sometimes it can be really helpful after birth if you're engorged or if you need to release some of the milk because your breasts are really full and baby's having a hard time latching on. If there's any separation between mom and baby at birth where the baby's not able to latch on, then a pump is really helpful in establishing milk supply. If mom's going back to work or is going to have frequent separations from the baby, then a pump is probably going to be necessary. But if you're a mom who knows that you're really not having consistent separations from your baby, you don't need to have a breast pump in order to nurse.
Okay, awesome. Because I know they kind of make it seem like you need to go buy a breast pump.
Right. Breast pumps can be really helpful, like I said, for, engorgement or needing to release some milk, those kinds of things. But if you're planning to stay home with your baby, maybe you can get just one of the handheld breast pumps that are, I guess maybe around $20 or $30, as opposed to the double electric, breast pump that comes with the really fancy bag. that can cost, $200, $250. Those are really nice for full-time or even part-time working moms. But if you're, even if you're just planning to go out with the girls or, go have some time off one night, go to the movie with your partner or something, and grandma's babysitting baby or something like that. You could even get very good at hand expression. I know a lot of women are very practiced at hand expression and feel like they're more successful expressing breast milk with hand expression as opposed to a breast pump. So, so just take a look at your situation, and sometimes it helps you gauge what kind of breast pump you need, if you even need one at all.
Awesome. Thank you so much. That's good information. Now, is there anything else you wanted to add information-wise that we didn't cover for pretty much Breastfeeding 101?
I don't know. I feel like we covered a lot. Just like I said, just kind of watching your baby, getting to know your baby, trusting your baby's cues, and trusting in your body that, it's amazing what our body can do, and that breast milk is the most optimal, perfect food for your baby, and that your body knows what to do. We just sometimes have to trust in that process that our body's going to respond. And, as long as your breasts are getting the stimulation and baby's not getting anything in their tummy other than breast milk, your body's going to meet that demand, and your body's going to meet the needs that your baby has.
Yeah, very true. Yeah, I've noticed that my breast will tingle, and it's the milk coming in. Mm-hmm. And guess what? 5 minutes later, baby's hungry. It's like my body knew that she was hungry, so my body was getting ready for her. So that's really cool.
It's amazing. Or if you're sleeping next to your baby, you'll often wake up, 30 seconds or start to rouse right before your baby's going to wake up. Yeah. And then your baby starts to wake up, and you're like, right, you're ready to nurse, and baby latches on, and perhaps you guys just go right back to sleep again. It's pretty amazing.
Yeah, it's amazing that they know what to do, and they're just this big. Awesome. Well, thanks, Laura. This was great information, and this was Breastfeeding 101, and look for us next time, and we'll cover engorgement.
Okay.